Doctors. When did a patient's lie nearly end up eliminating them? Story 1. I was a L&D RN. My coworker had a patient show up in labor. She was 6 cm. I was helping get the room set up for delivery, and the patient's mom started to ask her, "So, does that mean the baby?" And the patient violently shushes her. Her doctor wasn't on that night, and the office didn't have electronic records we could access at night. So we're just going about prepping for this delivery when her doctor happened to come into the nurse's station because she had to come in for a medical patient on another unit. She just stopped by to chat, but noticed that patient on the board and asks, "Oh, so her baby actually flipped?" Turns out the kid had been breech all pregnancy and was still breech. She didn't want a C-section, so she figured she'd just try to come in so far dilated that she could just deliver. That would have been okay if she was frank, breech, butt down, since it wasn't her first baby, but she was footling breech, cross legs with feet down. That's dangerous as hell because it's super easy for the umbilical cord to come out first instead of the baby, which cuts off baby's oxygen. My fourth was head down, and this ended up happening to me anyway. Emergency C-section in less than 10 minutes. Her baby was so lucky her water hadn't broken, especially if she'd been at home still. She still kept refusing the C-section, and my coworker finally snapped. We had another patient who was in for a stillbirth and had a lot of family down in our waiting room trying to process what had happened. My coworker asked if her patient had noticed all the crying people at the end of the hall as they were mourning their dead baby, and would she rather have a C-section or deal with the grief that family had. She finally got the stupid C-section. My coworker caught a lot of flack for checking that patient and not noticing she wasn't feeling ahead. Really, it's not worth gambling with things like this, but people can be very, very foolish. I know someone who was living with somebody else who ended up in hospital with TB. That person living with him developed a cough. But instead of wearing a mask and going in to get checked out, she just allows family and neighbors to visit and downplays her cough. They don't know she may have TB or that her roommate is in hospital with TB. They think it's just a lung infection. People are just odd. Story 2. I was admitting patients in the psychiatric ward. Busy night, and I was way behind. An older man with schizoaffective disorder is admitted with a caretaker. A nurse asks them a few questions, including if the patient has taken any medicine and/or narcotics. The caretaker says no. I see the patient 4 hours later. He seems delirious, which often is caused by a somatic problem, including medicine. You know where this is going. He can't maintain eye contact and can only sit in his chair and talk nonsense. He drools and yells every word, but somehow seems very tired. I asked the caretaker if the patient has taken any medication, and she says the patient broke into a medicine room at the institution he lives and just started eating random pills. Apparently, this is somewhere around 80 pills, not being more precise, because she did not bother gathering the empty pill boxes. The only information I could get was that he definitely ate over 40 lithium pills, which is just great if you really hate your kidneys. Now, after calling the emergency department to quickly prep an ambulance with an anesthesiologist for transport, I talked with the caretaker through my teeth, not slightly, angry. Apparently, the nurse wouldn't understand because it wasn't his own medicine and she didn't want to make a fuss. I screamed into my pillow that night in pure frustration. I later found out he lived after intensive care and almost losing his kidney function. Story 3. When we do our pre-op check before surgery, our office prints out a list of meds we have in file that the patient is taking. We tell them, please look at this list and sign it to indicate this is the current and up-to-date list of the meds you take. Patient signed, and we plan for surgery next week. Get a call from anesthesia the day before her scheduled surgery. Apparently, she forgot to mention she had started taking a weight loss drug that, if you're taking it, can cause severe hypotension when you go under anesthesia. And in extreme cases, you can die from that. You have to have stopped the drug for at least 4 days to be safe to have anesthesia. So her surgery got pushed back a week. Not canceled, just pushed back enough to be safe. She called our office fuming and demanding a refund for the time she took off work. Seriously, lady? Sorry, but we have a signed document saying you told us all your meds. Exactly who should be mad at who? You put us at liability, and now the surgeon, our office, doesn't get paid for that day when we could have subbed in someone else in that slot. Pretty selfish lady. Of course, she should have disclosed all the meds she's taking because you just never know what might interfere with the anesthesia or other medications that they might have to give you. Honestly, some people are just very entitled. Story 4. I work in an STD clinic, so the staff I deal with isn't usually deadly or at least not immediately deadly. However, I am constantly surprised by the percentage of patients who test positive and refuse to tell their partners. A guy came in a few years ago with something relatively simple like gonorrhea, but seemed to have trouble walking. Long story short, a nurse called an ambulance for him and sent him to the ER for a spinal tap. Turns out, an ex-boyfriend refused to tell him about his syphilis diagnosis after they had a rough breakup like 15 to 20 years earlier. So not only was our guy possibly spreading syphilis unknowingly, he now had untreatable neurosyphilis. He worked with our disease intervention specialist to track down as many partners as they could, but I think he died from related complications like a year after his initial visit. Story 5. Not a doctor, but an Army combat medic. We were in a small firefight and an NAA soldier was hit in the leg. It was very easy to see the wound because the desert camo doesn't blend in well with blood. The part that almost killed him is he never told us that he was hit in the chest. We asked him and he said only in the leg. I knew he was lying because he was holding his chest too, but I didn't want to make a bad situation even worse, so I didn't say anything. But when we asked him again and he said no, I didn't want him to die, of course, so I pulled his plate carrier off and we did more medical on him. He definitely would have died from that wound. It punctured his lung and he was having trouble breathing. We called for a medvac and he lived, but with only one lung. Never knew if he joined the NAA again, but I assumed he stayed out. So you saved his life, basically. I'm guessing he just didn't really know how serious his wound was, or he was just hoping it was nothing much. You don't mess around when it comes to lung injuries. You don't live long without them. Story 6. We had a patient that took her home heart meds religiously, even in the hospital when we were also administering them to her. She was educated to not take any of her home meds while she is hospitalized since we are giving her the hospital meds. She would speak and take them. Her blood pressure bottomed out and we'd have to bolus her. Security was called and had to remove the meds from her and lock them up. We had another patient requested a sleep med. The nurse gave it to her. Later, found the patient barely arousable and blood pressure dropped, which did not make sense since she was given a low dose of sleep aid. Patient had her purse open on the bed and found a prescription of Ambien. The patient took our sleep aid plus double dose of her home med Ambien. We also instruct patients on admission not to take their home meds while in the hospital. We are not allowed to go through their belongings due to privacy. Story 7. I work in outpatient surgical center. Lying to anesthesia can be really dangerous. I've had a person lie about not taking drugs and then react badly when given the anesthesia meds because they interacted. Fortunately for that patient, not nearly dying, but I will forever have it ingrained in my head, the anesthetist leaning over their head screaming, "What drugs did you take?" Another that I fortunately haven't seen serious event, but definitely has happened to our providers, and I've seen more wild versions. People eating, drinking before the anesthesia, and then denying. Lucky for my patients, they just have puked after waking up, so we know they had it, but made it okay. The danger is you can puke during sedation and then get it in your lungs, called aspirating, and die from that. Could be really bad, but fortunately I personally haven't seen the worst yet, but I've heard plenty of stories of it. What puzzles me is who do they really think they're cheating in the end? They're lying to themselves basically because it's they who will suffer and be responsible if anything goes wrong. You can give people so many chances to make the right choices, but ultimately it's their call when it comes to things like this. Story 8. Paramedic here. One common one is when older guys are having chest pain and we want to give them nitroglycerin, pace pills to help the chest pain. One thing that doesn't mix well is nitro and Viagra. It causes a blood pressure drop that can be really dangerous. We always ask and make it really clear that if we give the nitro and they're taking Viagra and similar meds, that they could die. It usually takes 3 or 4 warnings in a row before the guy will admit it. Early on, I made the mistake of trusting a guy after just a couple of mentions of how dangerous it would be. I sprayed the nitro under his tongue, and he said, "Does generic Viagra count?" Frick. At one point, his BP wasn't even registering on the box cuff. It was bad. I thought I was going to get screamed at by my doctor, but he just laughed and said it was so common that he wasn't upset and gave me a couple ideas on how to make it clear how dangerous it was to the patient. Story 9. Not a doctor, but I was in the ER once, separated from another patient by only a thin curtain. It was impossible not to overhear what was going on. She was an elderly woman who had taken an ambulance in due to feeling faint and said she had no other symptoms. Hours are going by. She gets up to use the washroom a couple of times and makes small talk with her brother, sounding pretty woozy the whole time. Doctors keep checking on her. They draw blood and check her blood pressure. I think it was like remarkably low, but they aren't sure why. Cut to several hours later when a nurse notices there's some blood on the woman's bed. After some back and forth, she finally admits that she had been bleeding profusely from her rectum for weeks. The doctors gave her a hard time, but got her out of there real fast. Wow, sounds like she just got used to the bleeding and didn't even consider it a sign of any danger. Strange, really, but people do sometimes pretend everything is okay when really it isn't. It's like maybe they're too afraid to confront that it might be a sign of something serious. Story 10. I wasn't the lead on this case, but I was the assistant. When I was in dental school, this patient came in and was really hyped up. My buddy asked him if he had been on any drugs, and the guy just said he had a lot of caffeine. Okay, we moved forward. From what my friend told me, his blood pressure was high, but not too high for an elective procedure. Part of the local numbing we give patients has epinephrine in it, and sometimes this gets into the bloodstream with certain types of nerve blocks. Not uncommon. However, if you've snorted a couple of lines of cocaine and then get epi on your bloodstream, that's no bueno. Ended up calling the ambulance. His BP was so high he was at risk for a stroke. So yeah, even stuff the dentist does can kill you if you lie. Story 11. One of my relatives had a bad reaction to amoxicillin as a child. Puffy face, trouble breathing, emergency room visit, bad. Fast forward 15 years, she's off at college and has come down with some sort of infection. She, however, didn't inform the campus health people because, and I quote, "Allergies are caused by a bad diet, and since I'm a vegetarian, I shouldn't have any more." Yeah, they prescribed her amoxicillin, and if it weren't for her roommate being home to call an ambulance, she'd have been dead. Yes, an allergy like that is very serious and won't just go away because of diet. These are strong medications, and some people just have very bad reactions to them, whether they eat a healthy diet or not. It's just one of those things you need to take seriously. Story 12. My cousin is an ER doctor and sees this quite a bit. Mostly, people lying about having done drugs and underage drinking because they don't want to get in trouble, not understanding that the doctors are less concerned with that than they are making sure the person lives. One particular incident. The person had drunk quite a bit and done several kinds of drugs but wouldn't admit to it, and came in alone, so there was no one to verify what had happened. Because this person wouldn't admit to the drugs they'd taken and thus wouldn't tell the docs what they had taken, they had no way to help and could do little except watch as this person slowly died from the drug and alcohol interactions, because without knowing what was already in their system, giving them anything could have only sped up the process. The person was a minor and passed away from massive organ failure because they were more worried about getting in trouble than saving their own life, until it was far too late to admit the truth. Story 13. Here's a messed up family story. We had an 81-year-old frail grandmother brought in by family for failure to thrive. In the setting of incurable stage colon cancer being cared for at home, patient was admitted awake and conversational, a poor historian, complaining of pain. She proceeded to gradually get sicker, shut down like she was dying, becoming gradually nonverbal, unresponsive, and dropping vitals. She was DNR, so we did supportive care and looked for causes such as UTI, SBP, sepsis, liver failure, etc. The family was around the whole time, acting very involved and caring. 36 hours later, she gradually started coming out of it before recovering back to baseline. It turns out she was given her home dose of morphine in the ER prior to admission, which was 100 milligrams extended release morphine twice daily. As she had been complaining of pain, her family had failed to mention that they had been diverting all her pain medications. That nearly got their grandmother killed. as we had no reason to suspect an opiate as the cause. That reminded me to always consider opiates. We discharged her to a long-term care facility. That sounds a bit sinister to me. Could it be the family were doing this intentionally to do away with her? Is she wealthy? Or does she just have money and a valuable enough property that could make them want to get rid of Granny the sooner the better? Creepy indeed. Story 14. The most frequent one is that they don't need a specific antibiotic or other life-saving drug because it is really just too expensive for them to afford. The fault is mostly with the drug companies. They find out they are the only ones making a specific drug and they raise the price just because they can. Then the insurance stops covering it and the doctors may not learn any of this until the pharmacists start calling his office to get the drug changed to something else. But there is no telling how many people die or suffer serious health problems because of the drug and insurance companies' greed. A lot of people get less than ideal treatment simply because of these middlemen trying to get their cut. Story 15. Social worker at a children's hospital. We have kids coming in through our resuscitation room that have been seizing and are unconscious with no prior history. I'm constantly trying to get parents to tell me if there is a possibility that their toddler might have ingested something. Does your kid have access to cannabis? Could they have eaten some? Parents never want to admit it to doctors, and so I'm always on a fact-finding mission. As a social worker, parents are either glad I'm there or they think I'm going to take their kids away. PSA. Cannabis can affect children in horrible, shut down your ability to breathe kind of ways. That's bizarre. I never knew cannabis could affect children in a serious way like this. I can't stand the smell of the stuff. Makes me gag. I tried it once and it had such a nightmarish effect on my brain. Young kids can eat just about anything they get hold of. They naturally just put things in their mouths. Story 16. Nurse on an ortho unit. This particular patient was a fresh post-op joint replacement. They woke up in the middle of the night going batshit crazy. He was insisting he had to leave. He was seeing things. We were on the 6th floor and he tried going down the back stairwell. There was no reasoning with this dude. He was straight up determined to leave. Turns out he was detoxing from alcohol. He had lied to both his doctor and the nurse that admitted him about his alcohol use. When you're a heavy user like he was, quitting cold turkey can kill you. We were lucky he didn't start seizing before we got meds on board to help him detox safely. I was very thankful I caught him trying to get down the stairs before he went ass over tea kettle and cracked his head open. A few months later, he was back on the surgery schedule to fix an injury on his operative leg from falling. Luckily, his doc knew to plan for detox this time around, but the patient also planned ahead. After he was discharged, we found a bottle of booze in the bedside table. Story 17. Vet here. So, in my case, it is the owner telling the lie that can kill the patient. It is hard to get the point across to people that I am not going to call the cops if you tell me your dog ate your drug stash. Just telling me will save time, lots of money spent on diagnostics, and possibly your pet's life. I really don't care if you do drugs. The only scenarios I can think of where I would call the authorities would have to involve deliberately harming an animal or extreme neglect that I know will continue in the future. Drug addicts should not have kids or animals, full stop. Animals especially have little protection from the harm these addicts can do, such as not feeding them or give them water. They suffer in silence. Children get taken away, but animals don't have a voice. Story 18. Middle-aged housewife comes to ED with episodes of headache and collapse, vacant episodes, usually early hours of the morning. Has the full workup with CT scans and lumbar punctures several times, always negative. It took several attendances before anyone asked her about recreational drugs. She was an unassuming suburban mom. Turns out she was into cocaine in a big way, leading to reversible cerebral vasoconstriction. No more cocaine, no more headaches, and no lasting consequences, luckily. Story 19. Not a doctor, but my sister's godfather was diabetic. He went to the ER because he had a really bad cold for like 2 weeks. He went in and they asked him if he was a diabetic, and for some reason he said no. Long story short, they gave him something that made his sugar levels go up, and he went into a coma. He died about a month later because his organs shut down. Edit. He was only 32 years old, just in case anyone was wondering. Well, in the end, he killed himself by lying to the doctors. Nobody should get the blame for that. I can't help but wonder why he said he is not diabetic. My dad is likely diabetic too, and he just eats so much sugar every day. I've tried to tell him he is probably diabetic, but he doesn't believe me. Never gets tested for it. Story 20. My, well, step uncle, brother of my stepfather, never met him though, lied about being in pain, sick, so he could stay home from school and miss a test. Kept upping the ante so they'd believe him. Apparently, his parents were pretty strict and he was terrified to admit he'd lied. Long story short, they took him to the hospital. He was diagnosed with appendicitis and they straight up cut him open. The test was looking pretty good at that point. Story 21. ICU nurse here. Everyone who drinks pretty much lies about how much. It's almost standard to assume the amount they say is half of the truth, if not less. 2 beers every day, you say? We will assume that's 6 and watch you for withdrawal. Kind of the same with cigarette smoking, but the difference is a pack a day smoker and half pack isn't as important as it is with alcohol. I think people are ashamed of being so out of control on their addictions that they just can't face telling the truth when someone confronts them about it. It's human nature in a way. It ties in with a lack of self-worth, I guess. Story 22. Had a grandma who was basically comatose status in ER. Whenever we would rouse her or get a word, she stated she wasn't on any drugs. We gave her Narcan, narcotic OD drug, with no effect. 20 to 30 minutes later, we do flumazenil, romazycon, benzo OD drug, and she wakes up. A lot of people weren't suspecting her of drug OD, given her age and statement, so they were thinking 900 different routes. Story 23. Not a doctor, but my dad's a paramedic. He's told me plenty of times about when patients have told him they've taken XYZ drugs when they've been doing illegal drugs to avoid getting into trouble. And he's administered drugs which just take it 10 times worse because of the combination of them. And he can't do anything else other than just take them to the hospital if they're still breathing. There's only so much you can do for people who don't care about themselves or value their own lives. If they don't tell you, then you just have to go about your work as normal and hope that they haven't lied to you. And if they have, then that's their responsibility. Story 24. When patients lie and say they haven't eaten anything prior to the elective surgery, when they have. I caught a patient snaffing biscuits that her partner had brought in front of her because we are so cruel to deny her food. People can die from aspirating stomach contents during a GA. Story 25. I'm not a doctor, but a patient with a couple of really weird disorders that cause doctors who aren't familiar with them to think I am taking. I have been denied very needed basic treatment like a bag of saline because my dehydration is exasperating my symptoms because they think I'm somehow gaming the system. These assumptions that patients are lying do a lot of harm too. Story 26. Paramedic here. When you do drugs, don't lie about it. Don't leave shit out. We're asking because they can have adverse effects with other meds and it might kill you. Yeah, paramedics see a lot of stupidity, I imagine. They must be the most patient people around because they hear so much BS from patients who think they are the only ones clever enough to fool anyone, when really the paramedics have seen all the tricks before. Click on one of the videos on the screen now, or Karen will sue you.